And some of the things that really get me excited about seeing the changes with our patients is patients who have terrible, horrible, degenerative, arthritic pains and problems and don't have any pain and don't suffer with it anymore, or dramatically less at the very least. And that takes a combination of things and an awful lot of work. Unfortunately, in our society that we live right now, arthritis and degeneration of joints is becoming far more prevalent than ever before because we don't move. The majority of our jobs now are sitting in front of a computer screen, where during the day we become very mentally fatigued and become very tired, but not physically tired from our bodies moving like we did 20, 30 years ago. And in fact, we have far more neck problems and back problems and more surgeries than ever before because of the lifestyles that we're living. The problem is in order to reverse some of these issues and problems that we have, you as a patient, me as a doctor, we have to work together. I can't fix it all by myself. You have to make decisions and choices to maybe eat a little differently, exercise differently, and sleep a little differently, and make some changes. But most people would rather take a pill that's going to create less inflammation for a couple of hours in their body, because that's a lot easier than doing the work to really physically fix your body. It's a hard choice, but it's a hugely rewarding one if you make that decision. And some of you, when I first met you, couldn't walk, couldn't bend, couldn't turn, couldn't do a lot of things, and now you're up and walking and doing all kinds of stuff. If I took another x-ray of you, I might see only the subtlest of changes. That same terrible, horrible arthritis that you once had is still there. But you're able to move now, and you're able to do things that you couldn't do 6 months ago, a year ago, maybe 5 years ago or more, when everything hurt so bad. So as a group, you're saying, I'm willing to do that. I'm willing to make the change. I'm willing to be consistent with my appointments. I'm willing to do the exercises. I'm willing to change my body, even though I have this problem, instead of taking the easy road of just popping a pill and letting everything on the inside continue to rot and just pretend it's not there because I don't feel it for a few hours and forget about it. It's a big difference in thinking. But our culture's changing, so we're trying to make everything, just fix everything with a pill. Nothing's really fixed with a pill. We just don't feel the same when we take a pill. The underlying issues are still there. No pill I know of has ever cured anybody of anything. If you take high blood pressure medicine, unless you're doing something to really change your body, 20 years later, you're still taking high blood pressure medicine. You're on cholesterol medicine, it's for forever. Unless you're going to really do something to change your body. See where I'm going? It's a lot of work. So let's talk about some of the different types of arthritis. Number one, what I'll do is I'll turn this clicker on. To make it work a lot better.
There it goes.
There we go. So, what does arthritis mean? So people say, oh, you know, my doc says I got arthritis. Okay? So arthritis is the most general term, and maybe any type of a diagnosis of anything we do in chiropractic, a diagnosis of medicine, or anything like that. So all it means is painful inflammation and stiffness of the joints. And literally, if you break the word down, arthur or arthro is joint, and itis, if you hear itis on the end of any word, means inflammation of. So we're just talking about having inflammation of your joint. So basically, anytime you have a joint that's swollen, by definition, it's arthritis. So, but there are conditions, and I want to try and separate the types of conditions that come along with arthritis, understanding that what I'm teaching today is a two-part class. I'm going to focus on the joints and what it is so you understand it. In a couple of weeks, I'm going to do and I'm going to go over a couple of things you can do today to understand. But the next class is really going to be about the difference between the types of medications and the difference between the types of natural things that you can do if you choose to take the action to make a difference. okay? So more intensely, I want you to get the understanding. So when I explain the other things that work to make your body better, you understand why it works, okay? Instead of here's a pill, okay? So that's all it means. So we break it down into 3 basic types. There's, let me go back a second, immobilization, degeneration, meaning things are not moving, and then the joints start to deteriorate and break down. There's autoimmune types of arthritis. I'm going to use rheumatoid as an example, but there's psoriatic arthritis, there's arthritis in the joints that comes from Lyme's disease. It's whenever your own white blood cells start to attack your body, thinking that that is a foreign tissue, because it's very similar in compound to a bacteria or a virus that it once got exposed to. That's the theory. The body starts attacking itself in these types of conditions. And then there's osteoarthritis, which is the wear and tear, breakdown type of arthritis, where there's not a disease necessarily of immunity or something like that, but just a wear and tear on the joints. I'm going to explain some of the things about all of these things so you can understand them a little bit better. So I'm going to start out with rheumatoid arthritis. Rheumatoid arthritis in its most severe stages, you'll see deformities with the hands and things like that. One of the older chiropractors sadly had a horrible case of rheumatoid arthritis, and as he worked for many years, his hands started to cramp up, and he actually, instead of quitting, he formed a whole different technique that a lot of chiropractors throughout the United States actually use today. And so because of the terrible arthritis he had in his hands. But the rheumatoid arthritis is a systemic inflammatory process, meaning there's something in your blood, it affects your whole system. And it typically, the rheumatoid factors and things that go along with it, this autoimmune disease, usually doesn't just affect the joints. Sometimes it can affect the tissues, the heart, and other internal organs that have a similar lining. And what this does is it actually attacks this is when the body, like I mentioned before, attacks itself, right? As the own immune system is confused, so to speak. And we get this inflammation and inflammatory because of the damage to the joints. We get this swelling in the joint. But one of the things that differentiates it from other types of issues is that if somebody has a rheumatoid arthritic type issue, if there's inflammation, they're not going to say, my right knee hurts. It's typically going to be because the inflammation is systemic. They're going to say, both of my knees hurt. Both of my shoulders hurt. Both of my wrists hurt. Both sets of fingers on my hands hurt. So it's attacking bilaterally all the joints at the same time. It's not just going to pick one joint. Okay? There are genetic and environmental factors, so nobody really knows exactly what causes rheumatoid arthritis. There are some people that seem to be more prone. It's more common in women than it is in men. And it seems to be that in families it does run. So we're not really sure if there's a clear-cut genetic pattern that some, and when we talk about genes, we all have a little bit subtle little difference in our genes, right? Makes us have brown hair or brown eyes or blue eyes or blonde hair, right? But mostly we're the same. But some of our genetics allow us to be, some of the genes can get triggered from certain stresses, and then we become more susceptible to certain conditions. So our genes, and from this point, these types of diseases don't necessarily cause us to have rheumatoid arthritis, but if those genes in our cells get stressed enough, long enough, it like flips a switch and sets off a trigger that can allow this to continue in our bodies. Does that make sense? So when we say, anytime we talk about genetics, we have to talk about environment too, because there has to be something in the environment that is stressing the body enough to trigger the gene to make it happen. So when we say, well, my mom had rheumatoid arthritis, my aunt had rheumatoid arthritis, I want to make sure I go for blood checks when you fill out your family history. The doctor's going to want to run what's called the RA, or rheumatoid arthritis test, to see if you have titers or any of the stuff in your system that may make you go that direction. But there's always going to be some environmental factor, I can't say this enough, that's going to trigger the gene. And if you avoid the environmental factors, you have typically will decrease your chances of triggering the gene. Does that make sense? Okay. So we don't have to have everything our parents have if we do things differently than our parents did. Does that make sense?
Yeah.
Okay. So blood test, like I mentioned, diagnosis for the RA factor can tell you that you have it. There's also juvenile RA, which means it's gotten triggered in kids and children, right? The rheumatoid arthritis, it attacks the lining or the cover around what's called the synovium of the joint. It doesn't actually attack the cartilage itself, but everything that surrounds and holds the joint together is what gets attacked in rheumatoid arthritis. And because there's nothing really holding the joints together with any stability anymore, is what allows for the things, the joints and bones, to slip all out of place and become deformed. Okay? One thing that's important that we should note, and this is important for all the types of arthritis, is that inflammation that comes with the type of arthritis is part of the natural healing process. We need inflammation. Whenever there's damage done to the body, the cells will release chemicals that create inflammation to start the process of healing to occur. It has to be there in order for the joint to heal. One of the things that came out just a few years ago was a study that told us taking people who have no matter what type of arthritis, who take anti-inflammatory medication on a regular basis to treat the pain and reduce the inflammation, actually show a faster progression of the degeneration in arthritis. So while the medicine makes you feel a little better, it's actually making the disease progress faster. Because you're taking away the body's natural healing process by interrupting that inflammation. Does that make sense? Okay. We'll talk more about that in the next class when we get into the treatments, but the immune response is incorrectly targeting the joint tissues, which we just talked about, and I just mentioned all that. So osteoarthritis is the next type. So osteoarthritis is more common. It's arthritis, what we call wear and tear or overuse type of arthritis. And again, like I mentioned before, where the rheumatoid might affect two joints, osteoarthritis is just going to be the joint that's been overused or worn down or tore down from injury or repeated injury over time. So it's experienced by people who have repetitive type motions. And so I threw this in there: carpenters, plumbers, electricians, factory workers, dentists, surgeons, and chiropractors, by the way. We do a lot of repetitive stuff. I don't know if you've ever observed us working through the day. It's very similar. Bent over, hunched over. We're working in poor postures a lot of times, and it's stressful on our bodies. Those who've been with me a little while know I wore out my shoulder a couple of years ago and went and had my shoulder surgery to repair it. It's really good now, so I can keep going. But it's hard on our bodies, and most chiropractors end their career with a bad back, of all things. And it's the most common thing, that the positions that we get into and the stress we put on our bodies. And sadly, a lot of that is because while they were adjusting patients all the time, they weren't getting adjusted. They weren't following a care plan like we would recommend for you guys, because they were giving their hearts away and serving, but they weren't taking care of themselves. Or maybe they weren't going to the gym and exercise, or maybe they weren't eating all that right, or maybe they were doing all the things wrong, but they were telling everybody what to do, but not really living it. So for me, and observing a couple of my friends that have been in horrible pain and disc injuries and knocked out of practice for months at a time or out of practice altogether, in 30 years of doing this, I'm watching some of my friends not be able to practice anymore already, that are just in their 50s and 40s. So for me, I exercise regularly. I eat pretty darn good. I will not say perfect. You will see me out and about in town. Probably every time I do something wrong, a patient walks into the restaurant. And my wife laughs about it, because if I'm having a martini, somebody's walking in the door. If I'm having myself a big steak dinner, and there's a big loaded baked potato right next to that steak, somebody I know is coming by any moment. So I'm not saying perfect, but I do the best that I can. I do love a good steak. So the repetition is the problem. Most common type of arthritis, absolutely. Often misdiagnosed with the other types of arthritis by arthritic conditions. And we need to kind of move into this other, let me go through this. The deformities, the swelling, and the joints, they look different. You get these little nodules that are forming the tendons from the irritation around the joints when you have it. It's not the same. You don't get the disfigurements that you would get, for example, in the hands like you see with rheumatoid arthritis. This is actually the wearing down of the actual cartilage itself on the inside. It's not the covering. So the joint can stay stable, but it's just very inflamed and painful. That, already talked about that. I said that was painful. And of course your chiropractor is good at identifying these different types and letting you know that also. We just can't, we send you to the medical doctor if we think it's rheumatoid so we can get the blood test done to be sure. So subluxation degeneration. This is the immobilization type of degeneration. Now in chiropractic we've always talked about a bone being out of its normal position. Means that it's going to be functioning differently than it was designed to function because it's not in its normal position. This is oversimplification with a little dash of New York sarcasm in it. Okay? It's the most simplest thing to understand. If the front end of your car is out of alignment, what happens to the tires? They wear out because they can't handle the load the way they were designed to work. They can't run off just the corner of the tire and last very long. And your joints are exactly the same. If the bones are twisted and turned and bent inside and all the pressure's on one corner of that disc is going to wear out and break down and you're going to have a herniated disc and the disc is going to degenerate and you're going to have, and the body's going to lock down all the muscles and create a lot of spasm and it's not going to let it move. You're not going to get blood and nutrition into those joints and they're going to break down even faster because it stops moving. I just did half of the next couple of slides. Right? I just flew through that. Subluxated joints begin to degenerate immediately. So a cool study came out, again, probably in the 7 to 10 year ago range, that showed that we were always saying, hey, you know what? We've got to immobilize joints. This is what we used to do. So if you think back to what a knee surgery, for example, looked like 20 years ago. Well, 20 years ago, if somebody had knee surgery, they came out with a cast. And then they left that cast on for months. And then they took the cast off and they moved that person into a brace. And they started to try and move this joint that hadn't moved now in months, that just went through this whole major inflammatory process called surgery that occurs, and a whole bunch of healing that comes along with it. And all that extra inflammation means a whole bunch of more scar tissue. That means all the scar tissue formed around the joint. And now we got to break all that scar tissue back up and try and force this joint that hasn't moved in months to start to move again. And it would take 2 years sometimes before somebody could walk without a limp after knee surgery. If anybody knows anybody now, before you wake up from surgery, you're hooked up to a machine that's moving your leg. So it's moving before you. You're still zonked out. You haven't even come out of anesthesia yet, and they've got that leg moving. Because now it can't get scar tissue wrapped around it. Now it can't start this whole degenerative process. And now it doesn't take 2 years. Now people sometimes are walking out of the hospital with a cane 2 days later, or even the next day after a big knee surgery. And they keep telling you, you got to move it. Well, we started to realize even a young child who has a cast on their arm, within 2 to 3 weeks we can start to see degenerative and arthritic changes around the joints where that joint is casted, where those joints can't move. Immobilization degeneration doesn't care how old you are. If the joint stops moving, it starts to deteriorate immediately. It has to have motion in order to get blood and nutrients and repair itself every day. So by that understanding, one of the things that most of us do when we have any type of arthritis and we're in pain is we move less because we're in pain. When the very thing that we need is to find out, I can't move a lot, but what little can I move? Because even the littlest amount of motion stops that degenerative process. From a chiropractic standpoint, when you have a subluxation that's causing all this degeneration and deterioration, the very first thing we want to do is go in there and force it to move, because it's stuck and it's immobilized. And as soon as we start that process, it doesn't matter how much degeneration and arthritis is in there, you get up and start moving. And you feel a little bit better over time, and you start to heal and reverse this process instead of continuing to degenerate and deteriorate and rot and take a pill and pretend it's not there. Does that make sense? Okay. So I have to go through all this anatomy and physiology and stuff like this. I want you to get why this works, right? So the normal process within years, we have categorized into phases. So there's phase 1, phase 2, phase 3 degeneration, and phase 3 is bad, right? This looks like some kind of something that gets, maybe, hey, Halloween's coming up, right? You can see maybe some cool teeth to make a great pumpkin thing to carve out. I don't know. But this is what a healthy one looks like. There's a healthy disc, plenty of room and opening for the nerves to get through. Doesn't matter where it is. We have what's called the vertebral body. You can see the nerves coming out through the nerve roots and the openings that will be formed between two. Again, x-rays. This is the neck. You can see a good healthy neck here. Subluxation, because if you can see the positioning of the bones, this curve is backwards, which is incredibly common now because everybody's walking around like this on their phone. They're on tablets, they're on computers. The head's way off the shoulders, not up over the shoulders the way it's designed. And we have a whole class we do on tech neck and things like that. We get into that in more detail. But the joints deteriorate and break down and eventually grow over and become a solid tube of bone that will never move again. And it can happen rapidly once it starts. This is an example for the mid-back. You can see all the joints are fused here. There's hardly any space in between for the discs. So what happens as we age, we end up with that kind of hunched posture that we can't undo anymore because the bones actually fuse that way. That's it, they're stuck. They're not going to move again. But that's from not moving. This is a cadaver slice. This is a beautiful, healthy disc. Look at this one over here. This is the low back. Beautiful slice here. We can see the nerve there. You can see a nice disc bulging into the spinal cord and spinal column here. Big, giant, almost looks like a bird's beak coming off here with all the bone, extra bone growth that grows because the body is trying to stabilize itself and give it some strength, and it grows all this calcium and bone, extra bone tissue for all the abnormal pressure that it's under. So, what steps can we take? Understanding, again, two-part class. We're going to get into this part in much more detail in the next class. But having this understanding of how the joints work and what the joints need to be healthy will make the next class make much more sense. So the next class I'll spend a little bit of time on what we just talked about and a lot more time on what you can do, but just some like teaser tastes of things. Number one, you got to maintain a healthy weight. The more weight we put on the joints, the more pressure the joints are under. Is that simple? Simple math, right? That means we have to do exercise. We need exercise for two things. Number one is to help control the weight because there's so much sugar in all of our foods right now. Even if you try to eat somewhat healthy, sugar's slipping in somewhere, right? The food companies are bombarding us with sugar in our foods, and it got much worse when we went into this whole low-fat food diet plan that's just destroyed us because it sent diabetes through the roof because we started filling everything with sugar to get the flavor that the fat once had in the food, thinking that the fat is what was giving us heart disease, and we now realize that was totally wrong, but nobody really wants to admit that yet, but they will soon. But it was really the sugar that was already coming into the food at the time that was increasing all the heart disease and heart attacks, and the sugar is what gives us the bad LDLs, not fat. So now we're reversing everything, the cutting edge stuff. You hear people say I'm doing the ketogenic diets and it's complicated. There's a lot more to it than just some things, but there's a lot of issues, but we're starting to learn. You're decreasing your sugar, cutting down your diabetes numbers, cutting down your bad LDL numbers, decreasing inflammation in your body. So all kinds of incredible things that we're seeing in the patients that are doing it and pulling all that sugar out of their diet. So exercise is critical. As I mentioned, there are some anti-inflammatory natural foods. One of the things that's not on the list, but it's not necessarily food, you know, fish oil tablets have become like a craze, right? So people are taking fish oil all the time because of the heart disease, and it's good for your heart. Well, the reason it's good for your heart is because it's taking the inflammation out of the arteries that are building up in your body. So taking the inflammation out of the arteries means they're not going to get damaged, means they're not going to form scabs that are one day going to form a clot that's going to go into your heart or into your brain and give you a heart attack or stroke. Right? So you're doing something natural with food to keep the inflammation down in your body. Sugar and carbohydrates are the top key, most inflammatory type of food you can eat, period. So they make every condition worse. It doesn't matter if it's an allergy, asthma, arthritis, heart disease, anything, sugar makes it worse. But these are some other things that are just natural in nature. Cloves, ginger, rosemary. I mean, people know this. Turmeric is absolutely the major craze of everything right now, and people taking turmeric supplements. For me personally, some of the research I've read about it, you know I'm hot on D3. If you've been to any of my classes, vitamin D3 is critical. Critical because we're so low on it. Turmeric is the #2 thing that I recommend for almost every patient, unless you're on the most cleanest, healthiest diet with very little stress and you exercise at least 4 or 5 days a week. Turmeric is important to add as a supplement to help control inflammation. Magnesium is another thing that we burn up because we're all under so much stress. Magnesium gets burned up faster than anything. Okay, those are my top 3. But cinnamon is an anti-inflammatory, great for anybody with sugar issues because it helps balance out blood sugar also. Oregano, basil, sage, and thyme, they're all anti-inflammatories naturally. They're great for anti-inflammation for guts. So if it's your irritable bowel syndrome or diverticulosis, these type of natural herbs that we can add to our foods, and please not processed. I mean, like, you know, go get yourself your little plant and pick it off and do it the right way. It's a little more work, but it's really worth it, the benefits that you'll get. So, and get adjusted, okay? Getting adjusted, we're forcing motion into the joints. The joints will then start to repair themselves because they're getting blood and nutrients. This is what is making us healthier. My concern for every patient is not how you feel, it's how you heal. So you can have good days and you can have bad days, and you can be a 9 out of 10 one day and you can be a 6 out of 10 the next day. But for me, are you better this year than last year? Are you better now than you were 3 months ago? We're all going to have ups and downs because we all have different stresses on our bodies all the time. But in the big picture, are you healing better? That's the most important thing for us as a doctor. Should be for every doctor. Not just to stop a symptom with a pain pill, but actually do something to help and encourage the patient to participate with you and say, you need to exercise. I don't care what you can do. I don't care if all you can do is wiggle your toes, but we're going to start there. But you're going to do something to help in this process. The nerves are a big part of that. We have to make sure the nerves, the brain, is sending healthy messages to the body, not irritated messages coming through all these irritated joints all the time. Chronic pain patients who are in pain for long periods of time have much more brain, they lose brain function faster than anybody else because of the pain syndromes and what's happening to inflammation. Every joint can be helped. Some chiropractors only focus on maybe just the upper cervical and only adjust that joint. Some will only work with your occiput and your pelvis. Some will work on just the neck and the back and the low back and just the spine. And some, like me, are going to work on every single joint you have, because in my mind, if your foot is hurting and you're limping on your foot, your back isn't going to hold. That's my theory. That's the way I do it. I'm not the right chiropractor for everybody. I get that. And so there's other chiropractors in other ways, but this is the way I want everything moving and everything healthy in all your joints. Okay? So, the facets, discs, you can get this. I pulled this picture up because this is pretty good. You can see how it's cartilage worn out, and you can see actually the bone through the cartilage. And to me, I look at that and I go, that looks like it hurts. 2 pieces of bone just rubbing on each other when those joints are worn out. It's excruciatingly painful. So let's keep it moving. So I love this. This is written a long time ago by another chiropractor. There is but one cause in disease: the body's inability to comprehend either itself or the environment. If the nervous system isn't working properly, we can't understand what's happening in our environment correctly if all we're getting is pain signals sent to the brain, right? There is but one cure in disease: the body's ability to heal itself. No matter what we do from the outside in, it's still up to your own body to do the healing. Even as a chiropractor, if I do the adjustment and remove the thing or the obstruction to healing that you have in the subluxation and allow that nervous system to start to function better, it's still you that has to do the healing. If a surgeon goes in and cuts your kidneys out or your gallbladder or whatever it is, it's still your body that has to heal. All the healing is from within you. And that's the innate intelligence, as we call it in chiropractic. The body's far more intelligent than all the knowledge that we have about it, even to this day and age. So no matter what we think as doctors, it still has to be up to you and what goes on inside your body to make the whole healing process occur. So taking a pill and pretending it's not there is not the answer. Can we agree on that? We've got to do something about it. Little by little. It may take time to reverse 20, 30 something years of arthritis. My fear as a doctor, and this is my closing statement, is that as adults, I'll give you an example. When I first started in chiropractic, one of my first couple of patients that I got to see was an 88-year-old man, and I went in and I did his examination, and just a few minutes later another new patient came in, and it was a 45-year-old man. And I did both of their examinations. I put both of their x-rays through the processor. I pulled both of their sets of x-rays out, and I thought I screwed up. Because the 88-year-old man had no degeneration and no arthritis in his spine. And the 45-year-old man, his spine looked horrible. When I found out later and talked to them about their lifestyle differences, the 88-year-old man told me how he got up every morning and did a Jack LaLanne. Everybody remember Jack LaLanne?
Yes, I remember.
Did a Jack LaLanne. He's like, I get up and I touch my toes, and then I do this, doc. I go like this, and I go like, and I'm doing like this, and he went through like this whole like little. It took him maybe 10 minutes every morning, but that's what he did. He walked everywhere. If he had to go to the grocery store, he walked, because he's like, I don't need my car to walk 5 blocks. He says, I got friends that can't go anywhere because they're in their car all the time. Now they can't walk at all. And it was, but he was saying things, but it might sound silly, but he was right. And the 45-year-old guy sat at a desk all day. I see, this is my fear, kids who are on computer screens or sitting on phones who will come in here and put their backs on the flat of a chair and their head wedged into the, I can't even really do it, but you know what I mean, right? They're like this, and they're on these games, and they don't move. The biggest exercise they get all day is their 2 thumbs. And that's it. I don't know how bad, I can't even imagine in all of my thinking what these kids now are going to look like even when they're 30. And I have 90-year-old patients that can run circles around my 30-year-old patients. Just because of the way they live their life and that lifestyle of getting up and moving and doing and going. And everybody just wants to sit in front of the TV and this, or they're playing the video games. And when my daughter was young, I played video games with her, so I'm not saying that's bad, but she went out and played sports too. You know, she had a little bit of time and then go run, right? So to me, I see it and I'm afraid. I'm afraid that we become so sedentary that that's a big part of all the diseases we have moving forward. This arthritis is only part of the issues that we're facing, because almost every single disease people are dying from nowadays is inflammatory diseases. We don't die from infections like we did 20 years ago. Those were the big issues. Somebody got an infection and they died. Now that we've gotten so advanced with things, that doesn't happen very often anymore statistically. It's really more the inflammation that we're all loading into our systems from not making healthy lifestyle choices. So, I hope I inspired you a little bit to maybe just do a little more between now and the next class in a couple of weeks. Like I said, it doesn't have to be a marathon. It doesn't have to be going to the gym and lifting weights. It could be just saying, I'm going to walk to the corner and back. I'm going to walk to the mailbox and back. I'm doing something to keep my body moving every day. Okay? Thank you all for coming. Hope I taught you a couple of things. And I'll see you in a couple of weeks.
Thank you for watching our video. If you like what you saw, be sure to subscribe to our channel.
Yeah, and like us on Facebook. There's always a lot of information also on our website at rosemontchiropractic.com.